Hello everyone, today we'll be talking about Osborn wave. Osborn wave is also called as J wave. It is a positive deflection seen at the J point in the precordial and the true limb leads. The precordial leads mean the chest leads, that is V1 to V6, and the limb leads are the 1, 2, 3 and AVL, AVR and AVF. It is most commonly seen in patients with hypothermia. So before knowing what is J wave, we should know what is J point. So if this is a normal ECG which is showing up normal P wave, Q wave, R and S. So this is ST segment. So this junction of this ST segment and this S wave, this point is called as the J point. So normally this point is very significant, important in cases of ST elevation MI, where we generally say if patient has ST elevation MI, if there is ST J point elevation, you can see J point elevation here. At this point, so this J point elevation is not called as J wave, but J wave is the additional wave which comes at the point of J wave is called as the Osborn wave. You can see here, this is extra wave along other than that QRS wave. If you see extra wave, this is a J wave. This is highly characteristic or highly specific for hypothermia. You can see J point depression here. Okay. So causes of hypothermia generally not causes of Osborn wave are most commonly it is hypothermia. It is seen generally if the temperature is less than 30 degrees Celsius, you see this characteristic ECG pattern called as J wave. It is also seen, this J wave is also seen in other causes like hypercalcemia, acute myocardial ischemia, cardiomyopathy. It may be a normal variant and an early repolarization and left ventricular hypertrophy. But in case of hypothermia, it is more specific for hypothermia actually. Another important thing you should know about J wave is that in case suppose a patient have a myocardial ischemia, if the patient of myocardial ischemia has a J wave, it was found that in various studies it was found that this J wave can be a precursor for a malignant ventricular arrhythmias. So in any patient of MI, if you see J wave, you should be very careful. You should monitor that patient very carefully because this patient may get a malignant ventricular arrhythmias like ventricular tachycardia or ventricular fibrillation. Thank you.